Let's get some perspective now with retired Brigadier General Stephen Xenakis. He served as an Army psychiatrist. General, thank you so much for being with us. What is your reaction to hearing these reports about some folks potentially going overboard or attempting to go overboard on the USS Abraham Lincoln?
I take this as an alert. As a medical corps officer, we're concerned about the health and the mental health of all our service members. And anytime an incident occurs like this, we should explore it and as much as we can and get all the information about it and start to evaluate, is this a one-off? Is this an indicator of something that's bigger and more worrisome? And use that information to now think about what we can do to help with the health and the welfare of our service members, and if there's anything we can do for prevention. I mean, that's our responsibility as military healthcare providers.
Taking a step back, talk to us about the challenges and the mental strain that goes into a 250-plus day deployment.
Well, I'm not a sailor, so I'm an Army officer, or was an Army officer, and I can tell you that extended deployments of any kind really add all sorts of strain and stress on those service members who are on the front lines. And particularly if it looks like there's not an end point. So it's so open-ended, they're not sure what's happening. If the conditions are hard in any way, and they can be out of control, then of course that basic way of their quality of life that is so important just adds to stress. And everyone's got a break point. Everyone does, and it changes over time. And it's a matter of paying attention to that and knowing that we've got to take care of these individuals who are carrying the burden of the mission. So it's this, as I understand it, is a very long deployment. And there have been all sorts of circumstances that these sailors have had to face. So it's not surprising, in fact, that there may be some issues that's both about their health and mental health that are showing up.
I think you would agree that for Americans serving under these conditions that have reached that breaking point, as you called it, the best recourse would be to speak someone like yourself, an expert in mental health. I wonder if you think that is easy to do for these service members in this situation. Is there still a stigma around seeking that kind of help, especially when deployed?
There may be, but there's lots of ways of working around it, and there may be, I'm, as I said, because I'm not a sailor, I'm not sure about what the medical staff is on an aircraft carrier. But I think they could put together organized mental health teams. They could fly these teams out. They could sit down and either work with the sailors themselves, or in fact, so what works well is to work with the leadership and just sensitize the leadership, educate them about that, to understand what they need to look for, and as what they may be able to do to help these sailors get through these situations. So there's several options here that can be exercised, and just knowing that with experience that I'm sure many of the Navy mental health people have, they can configure them and put them together.
Before we go, I did want to ask about the strategic perspective. I imagine these conditions may also limit the Pentagon's options when it comes to planning for the war with Iran, despite the fact that we've learned that now there's another carrier group that is headed for the region. It's something that the Pentagon has to account for, isn't it?
Well, I mean, look, it's basic to everything we do in the military. I mean, I don't care if you're Army, Navy, Air Force, Marines. I mean, the operations, the mission effectiveness always rests on the shoulders of those people who are serving on the front lines. And we have to, it is fundamental to our effectiveness and the strength of our military to consider how healthy they are so that they can be the most ready and they can do their jobs. So this is part of planning. And we do that, we've been doing that for thousands of years, frankly. People have known that you've got to think about those individuals that are really in the quote unquote the fight, and what you need to do to make sure that they can sustain themselves and do what's being asked of them.
Yeah. Brigadier General Stephen Xenakis, thanks so much for joining us.
Pleasure. Thank you.